Hi everyone, I'm Tineke,
And I'm Chloe.
and together we are 5 times more. Today we have the amazing Rumbi, and today's topic will be placenta abruption. Rumbi, would you like to introduce yourself so everyone could know who you are?
Absolutely. Thank you guys so much for having me. My name is Rumbi. I am a doctor. I'm a junior doctor. I am training to become a GP. Before I was a doctor, I was a midwife, and currently I'm working in obstetrics and gynecology. So I'm really excited to be talking about this, the topic that you guys are going to introduce. And interestingly, I've had very, very recent experience of this happening to someone we were looking after.
That's good. So you're definitely well placed to talk about this topic because you literally have done it all.
Very well placed. So we're going to jump straight in. The first question is, what is placenta abruption? So placenta abruption is, if we talk about what the placenta is, it's what gives nutrition to the baby. And then this is me being very basic is the wrong word, but me just taking it back to the base level. The placenta is what connects mom to baby. It gets the nutrition, and it helps with it's how baby gets their circulation. When the placenta separates before the baby is born, so it comes away from the womb before the baby is born, that is what we would call a placental abruption. So it's what should happen is the placenta's there, it's feeding the baby, it's doing its job. You go into labor, you have your baby, and then once the baby is born, only then does the placenta start to come away and separate. And then the placenta is delivered after the baby. So that's what should happen. But in placental abruption, part or all of the placenta starts to come away before the baby is born.
Wow, it sounds quite serious. Do you know what causes it?
Such as with so many of these things, we have no exact idea to say 1 + 1 = placental abruption. So we don't know exactly what causes it, but there's definitely a few things that increase people's risk to potentially having this complication of pregnancy. I wanted to ask, um, have you noticed that maybe certain ethnicity are more prone to have it, or it's more prone to have it to certain ethnicity, or is that not a thing that studies or you notice? Not that I've seen or read, but having conditions like high blood pressure that could increase someone's risk, or evidence have shown that in people with high blood pressure, they might be more likely to have this complication if people have had this before. So if you've had placental abruption in a previous pregnancy, there's a chance that it could happen again in a subsequent pregnancy. Again, linked to blood pressure is something called preeclampsia. So that's also associated with having high blood pressure. Again, increases the risk. And something really interesting, which I might not have necessarily thought of without reading or learning about, is using cocaine. So the use of cocaine has been shown to increase the risk of having this complication. I don't know how they managed to work that out, but they clearly asked some people, put enough studies together, and yeah, and have found that.
That's very interesting. And especially the part, because one of my questions was going to be if it's happened once, could it potentially happen again?
That definitely is a risk. It is
Mm,
a risk.
okay, that's fair enough.
I wanted to add, so is there a special pathway that you have to go down? Is it a thing that because it happened to you before, do you tell your midwife about it prior to becoming pregnant, or your GP? Where do you go? Is there a special pathway for you? I would say, firstly, our preconception care in the UK is not as good as I would want it to be. So, ideally, these are things where once you're thinking about planning another pregnancy, you can speak to your GP and they or a specialist and say, this is what happened in my previous pregnancy. What are my risk factors? What do I need to do to modify that? So, for example, if someone has high blood pressure, how do we get that under control before I fall pregnant again? All these things, but I think we're just not quite there yet in the UK in terms of our pre-pregnancy care. When you do find out you're pregnant and you've had placental abruption before, absolutely, you must tell your midwife. At the booking appointment, when they go through 1,000,001 questions. Have you had this? Do you do this? Do you smoke? Do you blah, blah, blah? At that time, definitely mention it, because that is something which would require a consultant obstetrician's input during the pregnancy. If this was something that had happened to me or my relative, I would definitely want them to be looked after by a consultant during their pregnancy to monitor for any further complications or any complications in this new pregnancy.
Thank you.
Following from that, if you've had placental abruption in a previous pregnancy, does that make you high risk in another?
I would say so. I would definitely say so. And if there was something that we could identify which increased your risk of the placental abruption, so for example, if it happened because the person has high blood pressure, that makes you high risk. If it happened because of preeclampsia, that makes you high risk. So yes, the abruption itself increases risk, but other risk factors in your previous pregnancy, which may have made it more likely for the person to have an abruption, also make you high risk. I don't know if that makes sense.
Yeah.
So yes, I would consider the new pregnancy a higher risk pregnancy.
Okay, that's fair enough. So I think my next question is, what are the signs? How do you know, okay, I think something's up. How do you know it's a placental abruption?
So for me, any bleeding during pregnancy is worth getting looked into. So early placental abruption is usually a complication of later pregnancy in the last stages of pregnancy. But even throughout the whole pregnancy process, any bleeding, I would say you need to seek advice. So be that through your midwife, be that through 111, or if you're very early in pregnancy, it might be through your GP. But any bleeding in pregnancy, you need to be seen or need to be reviewed. So one of the symptoms of placental abruption is bleeding. And by bleeding, I mean bleeding from the vagina. So bleeding from anywhere, bleeding from your nose, by bleeding, I mean bleeding from the vagina. Pain. And again, tummy pain, which is out of the ordinary. So you're not having contractions, but you're having pain in your tummy. That's something that needs to be looked into. And again, at any stage in the pregnancy, if you're having tummy pain, I think you should still call your midwife, GP, 111, etc., to get advice, particularly in the later stage of pregnancy. Now, if you're having contraction pain, but then in between your contractions, you're not getting a break, you're still getting pain, I would again consider that to be a potential sign that your uterus is not getting rest, your womb is not getting rest. So could there be something like a placental abruption? But those are the two big things, pain and bleeding.
Okay. And towards the later stage?
Towards the end of pregnancy, however, at any stage during pregnancy, if you're having vaginal bleeding or severe abdominal pain, you still need to be seen. It could be other things causing it, of course, but I would say those two, I would err more on the side of caution.
Okay, that makes sense.
I have a question. Can it be preventable? So imagine it's never happened to you before, and maybe a first-time mom, first pregnancy. How do you prevent it? Is it something that can even be prevented?
It's not. The best we can all do is try and reduce our risk factors. And it's those things like reducing our blood pressure. If we take cocaine, don't do it. Just reduce our risk factors. But this isn't something you can prevent. It's one of those things that just happens, unfortunately. I think that's what makes it scarier, is you can do everything absolutely perfect, have the most beautiful, low-risk pregnancy, and then something like this happens.
Yeah, I do really think there needs to be more studies on placenta abruption. I know my friend, it happened to her, she was 36 weeks, 37 weeks pregnant, and she just started bleeding, and that's how it happened. She's gone on to have another pregnancy, a successful pregnancy, and that happened in her second child. So her first pregnancy, nothing happened. Second pregnancy, placenta abruption, and then the pregnancy just recently, nothing happened. It was a normal birth. She wasn't high risk or anything like that.
Good.
Yeah, and I've always asked her, was there something that could have been done different. She's like, no, it just happened. Yes, I do think more studies need to be on it.
No, absolutely. I've got a question. Does placental or can't even say the word.
Placental.
Placental. Does placental abruption always lead to stillbirth, or are there any instances where you have a placental abruption and it gets seen on time and everyone's fine, everything's fine, baby's fine, mum's fine?
Yes, absolutely. It does not always lead to stillbirth. I would say in unfortunate and extreme is the wrong word, but in unfortunate cases, it can lead to stillbirth if the bleeding is very heavy all of a sudden and you don't have time to get to a hospital in time to be delivered. Those things can happen. But most of the time, I feel if women know the signs and symptoms to look out for and they feel that they'll be listened to when they tell us these signs and symptoms. So if someone has bleeding and they know if they call their maternity triage or they call their midwife that they'll be listened to, that someone's not just going to say, oh, ignore it, or because sometimes that's what happens. You call a couple of times and then those couple of times they say, oh, it's been fine, or you go, you get seen and it's fine. So when it happens a third time, you're like, well, they said it was fine the first 2 times. I don't really want to go again. I don't want to waste people's time. I really dislike when people feel that way, you know, that they're wasting our time, because they're not. So if someone experiences these symptoms, particularly bleeding, particularly pain, I would say the sooner you phone and get seen, the better, because then we can recognize early. And if we need to act, we can.
Okay. Very helpful. Thank you.
Very helpful.
So do you have any more questions?
No, I think that's it for me.
Okay, perfect. Rumbi, would you like to just round off? Is there any keywords or anything you'd like to say to round off this topic on placental abruption for anyone who's like maybe pregnant or thinking about pregnancy?
Yeah, I would say it's very rare. So I wouldn't worry about it going through my pregnancy. However, pain and bleeding. So particularly if you have bleeding from the vagina, always, always, always get it checked. Whether that's a phone call to the midwives, they ask you a few questions. They might say, oh, was it just on wiping? Was it after sex? And then if they can find a cause for it, fair enough. But if you have unexplained bleeding during your pregnancy, I would say that always needs to be checked. And pain, which isn't like the normal aches and pains. It doesn't feel like, oh, maybe I was on my feet too long, maybe I bent a bit too much. It feels like pain. You guys know what I mean. Again, that needs to be checked. So bleeding and pain, always please get that checked during pregnancy. But don't feel this is something you have to worry too much about, because it is a rare complication.
Okay.
Thank you. Thank you so much.
Thank you guys for having me.